Hello everybody, and we are in this second session of what Dr. Nischal says, Coffee with Ken.
Nice to meet you.
Yeah. So I have this very important question to Dr. Ken. We would like to help you to help us in the scenario of a child with a bilateral partial lamellar cataract with no squint and no nystagmus. It becomes quite difficult sometimes to decide when we have to go in and intervene, whether we should to operate or not to operate.
That's a great question. Great question. When I have parents, in fact, when I flew from Pittsburgh 2 days ago, I saw a child just like that, a 7-year-old child with bilateral lamellar cataracts. And the question that you have to ask yourself is, it's a balance. Firstly, is the child having visual problems? Secondly, if you take the cataracts out, at this moment in time, I'm reluctant to use multifocal IOL because of the effect on contrast sensitivity in children under the age of 8. So you're going to leave them, in my hands, monofocal, which means you take away their accommodation. This is a very, very important point. You and I'm much older than you. I'm at that point where I have to use bifocals for reading close up. It's a pain in the neck. It really bothers me. So you take a young person and they're now having to wear bifocals for close. It's a very important issue. Let me tell you what I do. If they're old enough, verbal, I will do a glare test. In other words, very simple, they're looking in the chart and they read with both eyes open, or one eye at a time, and I will shine a light in the eye that they're testing. If the vision drops by 2 lines or more, then to me it's a visually significant lamellar cataract, causing photodystopia and affecting the child outside. This is important. If a 7-year-old is trying to cross the road on their own, and it's a bright sunny day, and they don't see the motorcyclist, it's a danger to their life. So this is very important. If they're pre-verbal, I rely on the parents. These children often are very photodystopic, not photophobic, but they don't like the light because of the glare, the diffraction. And the parents are very clear about this, and they say that they won't go out in sunlight, or if they go out, they close their eyes. Those are important signs that the child's visual development is being affected. Under those circumstances, I would operate because the loss of the accommodative element is outweighed by the danger to the child when they're outside and on their own.
That's a very important and very good point, Dr. Nischal, you have told us. So that means any child effectively who gets visually disturbed by glare or bright light is a candidate for surgery.
Yeah, and so if they're old enough, I do the test to show the parents that the vision drops by 2 lines. So if they're running so any child 6/18 or 20/60 with both eyes open, I'm going to watch them, right? But now if I do the glare test and it drops to 20/80, 20 to 100, which is 6/36, right? Or worse, 2 lines worse, then I would intervene without hesitation. Without hesitation.
And if this does not occur,
yeah,
you would like to carry them till what age, till you put a multifocal?
Okay, so that's a good question. The next question is let's say you have a child who is 6/18 in the clinic with both eyes open. That's got to be the vision in the worst eye. You can't have a child who's 6/18 in one eye and 6/36 in the other eye. That's no good. You got to operate on the 6/36 eye, right?
Yeah.
If it's 6/18 in the worst eye, and let's say they're 7 years old, then the next thing I ask is, what is the reading like? Is the child's reading age what it should be for that child at school? If the school are saying the child's doing very well, top of the class, which happens, then I will just watch. I am now just beginning to think about multifocals in children over the age of 14. Now, there is some new information, it's not been published, so I can't really tell you with great conviction. It's not work that I did, somebody else did. They're suggesting that there's one type of multifocal IOL that has the same contrast sensitivity as a unifocal, monofocal. Now, when that paper is published, then I think we can start to look at that multifocal for children.
Younger than Younger than 14.
Younger than 14. But until then, that's my cutoff.
Okay. And thanks. As always, it's been a pleasure talking to you, Dr. Ken.
Absolute pleasure for being here. Thank you so much.